Alaikum and good morning. This is Amara Afzal, and I am a lecturer in pharmacology at the University of Islamabad. Today, I will be presenting my work on targeting the stress-induced uh, cognitive impairment via BDNF-TRKB modulation. This is a conceptual framework for natural product-based neurotherapy. So, first of all, let's talk about the importance of and the very reason that why I choose this program. Basically, chronic stress is one of the leading causes of the cognitive decline, and it negatively impacts the memory, learning, and executive functions, particularly affecting two main regions in the brain. First and foremost is the hippocampus, that is memory formation region, and second is the prefrontal cortex, that is decision making and planning region. And as the prevalence of chronic stress continues to increase globally, the long term cognitive effects are becoming a growing public health concern. Since you can see that a recent study in 2023 showed that out of the 24,000 and 500 people, over 45 were those with high assessment and had 37% higher chance of experiencing the cognitive functions. And similar is the case with the other study where after the age of the 65 or 50, mostly the BDNF level started to decrease, and because of this the patients were found with the significant levels of the cognitive impairment and memory disorders. So first of all, let's talk about the core problem or the problem mechanism. Whenever there is some sort of chronic stress, including the continuous stress of the exams, like you are being in the educational stress for like past 16 to 18 to 20 years, or the trauma or anxiety or any other psychological, you can say that stimulus, it can lead to the activation of the amygdala, which is the fear center, and amygdala in response sends the signals to the hypothalamus, which eventually releases the corticotropin hormone that goes and asks the pituitary gland to release the ACTH or adrenocorticotropic hormone, which will eventually move towards the adrenal cortex and ask him to release the cortisol. And after that, cortisol not only crosses the blood-brain barrier but also binds to the glucocorticoid receptors, and which are present basically in the hippocampus and also in the prefrontal cortex. And it will not only downregulate the BDNF gene expression but also the TRKB gene expression, and which will lead to the you can say that reveal of several other biomarkers that will reflect the synaptic plasticity, dendritic shrinkage and loss of synapses, reduced long-term potentiation, and increased pro-inflammatory cytokines, loss, and active oxygen. It will lead to the further consequences that will be faced by the very person who is among within whose body such mechanism is being processed, which includes the start of a vicious cycle, including the memory impairment and reduced learning abilities and executive dysfunctioning, and it's also the mood disorders. So let's talk about the research. Despite the growing understanding of the stress-induced cognitive impairment, current treatments mainly focus on the symptom management and have very limited efficacy. And most existing drugs are non-specific and come with long-term side effects, and most of those side effects are still unknown. Therefore, there is a clear gap in the development of the targeted neuroprotective therapies that can especially restore the BDNF TRKB signaling and improve the cognitive function without the side effects associated with the current drugs. This is where natural products come as in potential alternatives. So let's talk about the basically uh, real target, which is the BDNF-TRKB. Why do we choose this target? Like you know that natural products such as flavonoids, polyphenols, triterpenes, etc., have a promising potential in restoring the serum levels and maintaining the its expressions of the BDNF-TRKB signaling, and it will lead to the improved cognitive function and memory, you can say that performance of the respective person. So that is why we are choosing BDNF or KB as our basically key target. So let's talk about the role of the natural products where there are flavonoids, polyphenols, and triterpenes. And I have posted various examples, including the quercetin, lutein, apigenin, curcumin, resveratrol, etc., and their primary and secondary effects, and along with their mechanisms. The key function of using such slides is the key purpose of using such slides is basically to elaborate the importance of natural products and also to mask the very deficiency or limitation that why they are not being used currently in the market. That is because they have very limited efficacy, and the persons have to take them in very large amounts, and also most of the uh, phytoconstituents are such that their safety profiles are not being built up completely. That is why to if we can just overcome those deficiencies and we can just address those limitations, we can obviously treat each and every problem of the brain, including like cognitive impairment and chronic stress induced neurodegeneration and memory loss, etc., with just natural products from the natural origin. And for this, let's talk about the innovation that includes the use of the admit and AI and machine learning, where we have developed the necessary product database on the phytochemicals and compound library for the standardization and of the wavelength and their physical and basically chemical properties. And after that, will move towards the drug likeness screening to find the potential targets, and we have to make a competitive drug that will be mimic the structure of the natural substrate of the targeted receptor so that it will bind there but with more efficiency than the original receptor, with the original substrate, so that it can bind there effectively. And after that, we will do the AI-based mutual screening and target identifications for and which we have already done here, like BDNF, TRK, and TRKB receptors are our key targets. And eventually, we'll do the molecular docking to find the affinity of the newly discovered compound towards that specific receptor. After that, anti-stimulations will be performed, and through the network pharmacology analysis, will map a pathway, and we will just get an idea through the machine learning about how the drug will work actually in the body. Basically, we'll identify and discover its pharmacokinetics, and after that, admit profiling will be created, and after that, we'll just see that if the drug can cross the blood-brain barrier or not. Because no matter how much the drug is effective, if it can cross the blood-brain barrier, that means it will not be able to uh, perform its effective or potential functioning regarding the cognitive impairment, because its receptors are present in the prefrontal cortex and hypothalamus, as we discussed earlier, and those are present in the brain, and drugs have to reach those receptors by only by crossing the blood-brain barrier, because we are not using the intrathecal route of administration here. After that, lead compound optimization will be performed and candidate will be selected for the experimental validation. And regarding experimental validation, first of all, we'll go through the in vitro testing, and after that, we'll go through the in vivo testing, where we'll use the rats, rabbits, or any desired or any specific animal. Basically, in Pakistan, in the current scenario, I think we are able to use the Visto rats, and we can just see its effects, and after that we can make a product and we can just move towards the clinical trials. So let's talk about the key takeaways, where basically chronic stress not only impairs the cognitive function by suppressing the BDNF target and TRKB signaling, and but natural products like flavonoids, polyphenols, and triterpenes have potential to restore the neuroplasticity and improve the cognitive functioning by upregulating the BDNF and activating the TRKB signaling. And AI and CATs are essential in accelerating the discovery of the safe, effective neuroprotective compounds. And this approach bridges the traditional medicine with a modern pharmacology and offers a traditional path to developing the effective therapies for stress-induced cognitive impairment. And last but not the least, let's discuss the translational impact. Since targeting the TRKB and BD and the pathway using natural compounds offers a promising, safe, and scalable strategy for mitigating the stress-induced cognitive decline. So, by integrating the neuropharmacology with AI driving drug discovery, we can accelerate the development of the novel therapeutics and address their limitations very easily in the low budget framework, and we can just treat the cognitive disorders which are associated with the cognitive stress in a friendly way where patients can just buy those products, and because we have to get the phytochemicals from the local plants that are present here. And so this approach has the potential to bridge the gap between the traditional remedies and the modern drug development, and it will lead to the provision of the safer and more accessible treatments for stress related health. Thank you for your attention. I would be happy to take any questions. These are the references for my study. Thank you so much.